Today we're talking about AUHD or AuDHD, depending on how you pronounce it and say it. And it's really a combination of autism with ADHD. And even though they're two distinct disorders, they tend to co-occur. So hence we have the name AUAHD. So let's talk about it because it's a new thing for a lot of people. It's something I've been seeing as a combination occurring with many of the kids I've worked with over these 3 decades, and I love that they're actually encapsulating it and putting it together because it presents with different challenges. So, let's talk about, what it is, understanding autism, attention, how they overlap in AUDHD, right? So, these symptoms do overlap. And at the core, obviously, is going to be social difficulties, not just, you know, um, having an interest in social, but really social communication, pragmatics, reciprocal communication, understanding nuances and body language, and, all those little inferences that typical, autistics miss. That is what you're going to see here. And that really is probably the base more than anything. You're also going to see those restricted interests, sensory difficulties, but in addition, with this combination condition, right, you're going to see attention problems. Now, not all autistics have attention problems, but it's pretty common. But what sets this apart is this attention issue is really a clinical issue, right? So you might see zone out behaviors, you might see distractibility, you might see that hyper focusing at the expense of not listening or looking at anything else, which is pretty common with autism, especially in those restricted areas, right? So there is definitely an overlap between the two conditions, but they are different, right? People with ADHD don't have to have social difficulties. And if they do, they tend to have social difficulties due to impulsivity. It's not that they really lack an understanding of the nuances of social communication and that back and forth. They just are impulsive. They don't slow down enough to do it. Where with autism, really, they lack that inferencing ability. They don't really have perspective taking. They can't really see themselves in the shoes of other people, right? Back in the day when I used to do neuropsych testing and I would do the ADOS, which is sort of the gold standard in testing for autism. It's a play-based test where you ask questions through this back and forth interaction play, and it goes all the way until young adults. It's a great measure, especially when you're just not sure, because a lot of autistics are so intelligent they can memorize information and seem like they know what they're doing, but then when they actually go to apply it in the real world they can't, right? So they can say what they're supposed to do, but they can't do what they're supposed to do, right? So hopefully it's an aha moment. And that's where a lot of kids would get missed because it appeared that they understood, right? But somehow the professionals around them would be missing that it actually wasn't happening. And that's where Dr. Rowe would sweep in with her evals and kind of help to understand. So let's talk about supporting individuals with AUDHD, right? So I think one of the biggest things that we need to focus on is communication. And it's not just social communication, but when you're a teacher or you're a parent working with somebody who's on that spectrum, you want to make sure you're being very clear in your communication and taking the implicit and making it explicit. And as I mentioned earlier, a lot of times we have very bright individuals and we assume that just because you're intelligent, that intelligence means you can do everything well, right? Social, memory, everything. No, there's different facets of intelligence, right? And when it comes to social skills, it's definitely its own beast. And some people are amazing at it and maybe terrible in other things and vice versa. So we want to make sure we're being very clear in our communications. Most autistics have unbelievable visual skills. The cousin to this, nonverbal LD, not so much, but you want to make sure you're being visual, you're being explicit, um, and repeat and reinforce as much as necessary. I love role plays with individuals with autism I even did it with teenagers, right? Like, oh, what do you think would happen this, right? And you can kind of preview things and it will be very helpful for them so that they're not so much searching for skills that they don't have. They've already got a base for it. People who are neurodivergent in their weak areas, they're going to need a lot of practice and that's okay. So that's really important way to support somebody with autism or AuDHD. We also want to think about sensory supports. You can never not have enough sensory supports. So these are two clinical conditions that, 9 times out of 10, you're going to have sensory issues. In fact, I've never met somebody on the spectrum who didn't have a sensory issue. So putting sensory supports, having clear communication, and lastly, supporting them socially are probably three of the best strategies that a parent, a work environment, and certainly a classroom environment can do to support the needs of somebody on that spectrum. Let's talk about strategies for managing attention issues. So when you have autism and you have ADHD together, you have this piece in the middle that makes it even harder, and that's that restricted interest. So once you have a restricted interest, your brain wants to go to the thing that it wants to go to. And it's very hard to stay focused. So, how do we support attention, right? So, I think having that clear communication of what the expectations are, but also to have clear parameters. What is that rubric for that job, right? Whether it's at school or it's actually employment. What are the pieces that need to happen for that task to be successful? Maybe it's an SOP if it's at work. That's the version of a rubric at school. And making sure that they understand the different components and the time limit, because I think time blindness, go back and listen to that episode if you haven't, is a real factor, right? So helping them to understand what time is. And one of my best executive functioning tasks is to always get people to future think. So, what does the end result look like? So, ask them, what does this look like when it's done? Whether it's a test, it's a job at work, it's some type of project, because they don't activate individuals with poor attention always have executive functioning issues and they're just not activating, they're not seeing the end product. So executive functioning skills can be taught, and that is the linchpin. That is the piece that really helps build attention skills. Always cue them to start with the end result. What does that look like? Why don't you walk me through it? And the more they can make it visual, the more they can gesture, we activate our kinesthetic memory and it helps us to see the end result and then work backwards. That is one of the best ways to support attention issues for somebody with AU, DHD, or autism on its own, or ADHD on its own, or executive functioning. Really critical. If you are looking for more support, you're going to go to drroseann.com/help. You're going to take our solution matcher. It's going to guide you to the right solution for you, no matter what it is. Maybe you want to work one on one. Maybe you need some of our ADHD or autism resources, and you're just not sure. You're going to get the right resource and you're going to get tips every week from me. Because when you struggle, when you're neurodivergent, maybe it's you, maybe you're a parent, you're going to need professional guidance from somebody who's worked with a lot of people. So even though I'm a therapist, I'm not your therapist, but I can give you great tips and tools that are science backed to help alert the brain and support and help foster all the strengths of a neurodivergent brain.